I'm Professor Juliana Chen, Professor of Medicine and Therapeutics at the Chinese University of Hong Kong. Today, more than 50% of people living with diabetes in Asia-Pacific remain undiagnosed. Many of those receiving treatment do not achieve their HbA1c goals. Increasingly, guidelines advocate an individualized treatment approach to type 2 diabetes. We now have robust clinical evidence to show that DPP-4 inhibitors work better in East Asian type 2 diabetic populations. The East Asian patient study with sitagliptin is the most recent of these analyses.
The East Asian patient study was a pooled analysis that evaluated the efficacy and safety of sitagliptin 100 mg once daily. Baseline characteristics were similar across treatment groups. The results at week 12 showed that sitagliptin was associated with a significant overall reduction of HbA1c from baseline, with consistent results across Taiwan, Hong Kong, and Korea, Japan, and in mainland China. The safety of sitagliptin 100 mg, including hypoglycemia rate, was similar to placebo. Professor Chan, what are your main takeaways of the East Asian patient data with sitagliptin?
The data confirm that sitagliptin is an effective glucose-lowering agent with a safety profile similar to placebo. Other studies have also looked at ethnic differences in response to sitagliptin. For example, both the TCOS study and the meta-analysis by Kim and colleagues demonstrated that DPP-4 inhibitors had a better glycemic lowering effect in East Asians than in other ethnic groups. The East Asian patient study results with sitagliptin are consistent with this observation.
Professor Chan, what impact do these data have on a doctor managing type 2 diabetes in East Asia?
Any clinician treating patients of East Asian descent, not just doctors in East Asia, really must consider this growing body of evidence, including the East Asian patient study. The fact that sitagliptin reduces HbA1c consistently across all geographic subgroups strongly suggests its clinical value to treat patients in these settings. We are living in the era of individualized treatment, and as doctors, we are increasingly tasked to maximize outcomes for our type 2 diabetic patients by tailoring treatments. The DPP-4 inhibitors have a greater effect in East Asians than in other ethnic groups, and this relates back to the pathophysiology of type 2 diabetes and mechanism of actions of this drug class. The East Asian patient study with sitagliptin adds to the growing evidence, highlighting the importance of individualizing treatment in different populations. This will help us to optimize treatment outcomes in East Asian populations.